Hey everyone, so today I'm going to be showing you how I am going to be taking notes on some of my own notes or slides from school using one of my favorite YouTubers' methods, Ali Abdaal's spreadsheet technique. So what I have open here is I have Google Sheets where I'm going to be creating questions and answers and putting them all in here. And then I'm going to be going over the slides on this side. And what I also have open is a Google Doc of the different objectives that are probably going to be covered. Or these objectives right here, I created another doc to kind of answer them at the same time as we're going through the entire thing, just to make it a bit easier. And I'm going to probably take, I have a practice quiz after this, and I'm probably going to make some practice flashcards from what I create on the sheets here. So let's go through it. So some of the objectives: identifying bacteria, using tests, gram stains, and minimum inhibitory concentration, MIC breakpoints, test for antimicrobial sensitivity, and tests for identifying fungi, viruses, and other specialized microbial organisms. Okay, let's jump right into it. Okay, specimen and collection. Okay, so the first thing I'm probably going to ask myself is there anything here that I could probably create a question out of? Let's find out. Okay, the obvious thing here is there's certain areas that people can easily collect data from, which is pretty obvious, such as eyes, ears, tears or earwax, or body fluids such as urine, stool, blood, of course, the bones, and tissue samples. So something here that's kind of people probably wouldn't get the first time is knowing what BAL stands for, because of course we can get phlegm or different fluids from the respiratory tract, but not much people know what BAL stands for. So I'm going to demonstrate creating a question for that here. So what does BAL stand for? And that stands for bronchoalveolar lavage. Just gonna shorten this right here. So that wasn't too difficult, pretty simple question. Let's move on. Pretty straightforward understanding here. Okay, so the types of bacterial testings. So there's gram stain, culture, and sensitivity. So I think that was one of the objectives. Yeah. List and describe the tests used for identification of bacteria. So just gonna put that here. Gram stain, culture, and sensitivity. And we're probably going to go a bit more in depth into each of these methods, but it looks like the next few objectives are kind of answering that, so we'll just do it as we go through each section. Yeah, so probably a question I would create for this would be, what are 3 types of bacterial testing? Because if someone asked you this question straightforward, question is, would you remember all of it? Because the only thing I would probably pop into my head is probably just gram staining. So I'm just going to put that right here. Gram stain, culture, and I'm gonna type that out. And culture and sensitivity. That's a bit repetitive, but you know, that's not too hard to memorize. Gram stain, culture, and then you just memorize sensitivity. Okay. So before we move on, let's check out what the next objective we were supposed to look out for. Identify bacteria according to the gram stain results. Okay. Okay, I'm assuming that's gram positive and gram negative. Okay, next slide. Common methods of staining to characterize bacteria based on the nature of their cell walls can be either gram positive, where the bacteria has thick peptidoglycan cell walls, or gram negative, where it's thin. Okay, a question I would probably create for this. Probably what kind of gram stain has an outer cell membrane and thinner peptidoglycan cell wall. Because if I know this, the other definition is straightforward, because if it's not gram negative, then it's gram positive. So I just add that to objectives here. Identify bacteria according to their gram stains. As we saw before, gram positive bacteria have thick peptidoglycan cell walls. Gram negative are thinner. Okay. Next, explain and interpret minimum inhibitory concentrations. Let's continue. Okay, we have a picture here. Okay. So can we make a question out of this picture right here? Yes, we can. So what color do gram positive bacteria have? Produce, actually. And the answer would be purple. Okay, we have 4 questions so far. Doing good. Okay, more on gram stains. We're not yet on MIC, so let's see if we can make some questions here. Some more on the clinical application side of things. Empiric therapy. So this is viewable. That's what they mean by empiric. So this is how people usually differentiate the different types of bacteria after their stains. So there's a stain on them, or the bacteria can easily be seen for their shape. As you can see here, it's more of a rods, and this is more of the cocci, very circular. And as you can see, the organization, pairs versus clusters, can be seen in each of these. Lots of clusters here. Looks like pairs here. More linear, the organization looks here. And some of the limitations. So I could probably create two questions out of these. So first question will be, how are bacteria distinguished from each other? in empiric therapy. Okay. So the answer to this would be stain GP versus GN, their shape, I should just make this simpler, stain, shape, or their organization. Okay, for the next one, the next one could be a true or false question. Are there any limitations to the gram stain method? The answer to this would be, I should put true or false. And the answer to this would be true. There are limitations. And as we can see right here, intracellular, the bacteria could be intracellular. The bacteria could not have a cell wall, and the bacteria could be undetectable by light microscopy. So yeah, we created 2 questions from that. Pretty simple answers. And if I want to elaborate further, I could probably look up the slides to check out this information. Okay, now we're moving on to culture, not yet on MIC, so I think we're going to be going over the 3 types now. So just culture. Okay, so this is more on the identification by antibiotics. So we could probably make 2 questions out of this slide. So how, for culture, question I would probably create would be, how is bacterial culture identified by? For antibacterial treatment. And the answer to that would be genus and species. Next question would be organism identification. So this question would be, how are colonies distinguished from each other? Oh, I apologize for that. That's if you're hearing the background noise, it's people yelling in the background. Okay. Yeah, my house is a bit noisy right now, but anyways, how are colonies distinguished from each other? So we have, they can be in different growth mediums, environmental factors such as aerobic versus anaerobic. We can have biochemical tests such as enzymes and metabolic pathways. Okay, this answer is kind of long. Yeah. I don't think oh, it does. So I was checking if they both deal with antibiotic treatment, and it looks like all the culture tests do. So let's create some questions for this one. So culture and susceptibility test determine sensitivity of organisms to various antibacterial agents to maximize antibiotic treatment efficacy. Okay, so I think how I would formulate this question. Oh wait, let's read the rest. Okay, it's just the different types of tests. So a question I would probably create for this is, which test, and I'll just copy that, mouthful. So which test determines sensitivity of an organism to various antibacterial agents to maximize antibiotic treatment efficacy? And the answer to that would be culture and susceptibilities. Oh, what? Culture and susceptibility. All right. I don't think these tests are that important. Might be just extra information. You gotta understand what is important for you to recognize. And there's a lot more slides in this chapter, and it's not really one. Knowing this information isn't really one of the main objectives. Okay, now here we're getting into something new. And it looks like we're about to reach the MIC section, so we're about getting close to continuing our objectives. Okay. Microcereal broth dilution. Oh, and it looks like they define MIC here. So the difference between this method and others is that we are looking at quantities here. So the keyword here is the word quantitative. As you can see from these values here, we're able to see the different types of effects that the antibiotic has on the inoculum of bacteria that's incubated. So this value right here, this 2, is the MIC, has the lowest antibiotic concentration.
Hey,
So that means that it's able to be incubated easier. So the antibiotic concentration is smaller, or is completely gone at 2 micrograms per milliliter.
Are these all yours?
So the difference between microcereal broth dilution is that microcereal broth dilution has... How would I create a question for this? What is the difference between microcereal broth dilution and other antibiotic tests? The difference is that it creates a quantitative measurement of antibiotic activity. Or numerical, to measure the MIC. Okay, so that's kind of in my own words. It's pretty straightforward. So let's go back to the objectives here. So they want us to explain and interpret MIC and MIC breakpoints. So let's explain first what MIC is. MIC, or minimum inhibitory concentration, is the lowest antibiotic concentration that completely inhibits visible growth. So this is the explanation, and the next slide is on interpretation. Okay. I think I can make a question from this explanation. Okay, let's make a true or false. Is MIC let's make it MIC is the highest antibiotic concentration that completely inhibits visible growth. Okay, we can't sound unsure of ourselves, so we can't put a question mark there. So the answer to this is false. Okay, we're making a lot of progress so far. Okay, now we can move on to interpretations for MIC. So for interpreting MIC, it results from each antibiotic tested. So there's 3 categories. Resistant, as you can see here, R means is resistant. The bacteria is resistant to ampicillin, cephalofin, it's susceptible to erythromycin. There's no intermediates here. So this bacteria is gram-positive. So it's thick, has a thick peptidoglycan. Am I able to see a name here? Nothing. Okay. It's used to predict likely the response of patients to infection of antibiotic MIC breakpoint. Okay. So this is a prediction for a patient to see if that antibiotic will have any effect on the bacteria inside them. And the breakpoint. Okay, let's answer our objective right here. Explain and interpret MIC and MIC breakpoints. MIC results for antibiotics is reported as 3 ways. It can be susceptible, intermediate, or can be resistant. And MIC breakpoint can answer that right here. And the next objective will be describing and interpreting tests used in determining antimicrobial activity. First, let's make some flashcards for this one. Or, I mean, practice questions. How about if an antibiotic test for ampicillin is given an I, and for erythromycin is given an R. What do these two letters mean? So I equals intermediate, R equals resistant. Okay. Interpreting MIC results. Well, it says interpreting the breakpoint, so I think this is important information for the objective too. Okay. Okay, so it's pretty explanatory. It can be specific for an organism, for a drug. Let's create something for it to remember this mistake. let's make another true or false. You should select the drug that for an organism that has a lower MIC because it will be more susceptible to the drug. The answer is false. Okay. Next we move on to the disk diffusion method by Kirby Bauer. Can I make a question from this? How about what method did Kirby Bauer create for analyzing organisms? I go back to organisms here, I don't know why. It's alternating. So his method is the disk diffusion method. So in the disk diffusion method, okay, let's see if we have anything here. Interpreting its microbial sensitivity. Okay, we're good for now. Okay, agar plate, antibiotic, incubation, zone of inhibition. Okay, that's something interesting. Allows multiple antibiotics to be tested simultaneously. Okay, we probably think of two questions for this slide right here. So my first question would probably be, what makes, or what is measured in the disk diffusion method? The answer to that would be the zone of inhibition. Next question. True or false? The disk diffusion method allows, okay, I'll just copy this, save time. Multiple antibiotics to be tested simultaneously. Period. The answer to that is true. Okay. Next slide, molecular epidemiology, testing beyond genus and species. let's probably a question I would make for this is what is measured by molecular epidemiology? That's two things. Reinfection and relapse. I don't think this one is too important. It's more of the process. Okay. Next one, antibiogram. Method, test, susceptibility of an organism to battery? Kidding me? What does battery mean? Let's search it. Maybe I'm looking for biology. Yep, nothing's coming up. I'm gonna assume it means many. Antimicrobial drugs. That is an antibiogram. I'm just gonna make two from this slide. Whew. I think I'll include that here. Okay. How are antibiogram profiles generated? Okay. Here's an example. Okay. Now we're getting more specific. Specialized bacterial testing. What's the objective we stopped on? Determining antimicrobial sensitivity. Yeah, I think we're good right now. Yeah, let's continue with these. Specialized bacterial testing, mycobacteria, tuberculosis, opium complex. Yeah, probably come up with just one question for this one. Bacilli. A resistant cell wall. And longer incubation time. Specialized bacterial testing. You can probably come up with 2 questions for this. Okay. Next question. That is apologize for that. H. pylori. Okay, we got a practice problem right here. based on culture and susceptibility. Culture and sensitivity. Susceptible right here. Okay, now we're answering that last objective on fungi. So that means we passed the answer for this one. So let's check after MIC. This should be the first one. The disk diffusion method. Just the important stuff. Okay, there might be another method here. Finally, this should be the last one before we get into specialized bacteria testing. Okay. Now we can move on. So they wanted fungal, viral, and microbial. Specialized microbial. Okay. So that's all here. So let's do it in the order they want. So the first one is fungal testing. Yeah, I'm gonna go over all these first. We're gonna use Ali's method first to go over these, so we can pinpoint the important things. what makes fungal testing different from bacterial testing? Uses a special media for fungal growth. Longer incubation time. And specialized testing procedures for identifying genus and species. Okay, finally, viral testing. Okay, is dependent diagnosis during viral testing is dependent on what three things? Those are proper selection, collection, and handling of the sample. Next question. What is gold standard in viral identification? The answer to that question is cell culture. Or just create one more question. What are examples of molecular methods used for viral testing? Viral identification. Polymerase chain reaction. Whoops. PCR and the nucleic acid assay. All right. So that just does about it for Ali's method, guys. Went over all the slides. And yeah. If you guys have any other questions, please let me know. I'm probably gonna finish off the last of these objectives after this video is done. So the last of the testings is basically what I just went over with you guys in the last few questions I made right here. So if you have any other questions, please let me know. Please don't forget to like, comment, and subscribe if this method helped you. And as always, I'll see you in the next video. Bye. Or peace out.